Assalamualaikum warahmatullahi wabarakatuh. We are Group 7 from Section 4. We're going to present social mobility and health.
Assalamualaikum. I will be explaining about what is social mobility. Social mobility is basically the movement of an individual in a social strata, or in another meaning, movement of a social status. An individual might be having an improvement in their economic status, for example, landing a high paying job, in which they will go up in social status. However, they might also have a decline in their economic status because of bankruptcy, in which they will go down in social status. Continuing from the previous slide, the concept of social mobility was first introduced by a Russian-American sociologist and activist, Pitirim Sorokin, in his book Social and Cultural Mobility. He was born on the 21st January 1889 in the Nyas-Fagotsky district in Russia. He is also very well known for contributing in the social cycle theory by developing sociological cycle theory. You can see his face on the right side of the slide.
There are two ideas concerning the relationship between social mobility and health, which is first, social causation hypothesis, and the second one is health selection hypothesis. This hypothesis observes whether health determines social mobility or whether social mobility determines the quality of health. So for the social causation hypothesis, it states that the social factors such as individual behavior and the working environment determines an individual's health. Conversely, the health selection hypothesis states that health determines what social stratum an individual will be in. The findings for each of these hypotheses may depend on how a person's socioeconomic status is measured. Social causation hypothesis is supported when people looking at the relationship between health and socioeconomic status through education and their income. For instance, people with better education have more knowledge regarding health risks and health promoting behavior. Education also increases the sense of control, which will shape the healthy lifestyles. However, for health selection, assumptions are supported when people look at the social economic status and health through the labor market lens. The reason for that is health determines the productivity of the individual. For instance, poor health in childhood can limit educational achievement.
Our first detailed content is the types of social mobility. Social mobility can take different forms, and people can experience different types of mobility in different stages of their life. So, there are 6 types of social mobility. The first one is horizontal mobility. This occurs when a person changes their occupational but their overall social standing remains unchanged. The second type is vertical mobility. This refers to a change in the occupational, political, or religious status of a person that causes a change in their societal position. The third type is upward mobility. This is when a person moves from a lower position in society to a higher one. The fourth type is downward mobility. Downward mobility takes place when a person moves from a higher position in society to a lower one. And the fifth type is intergenerational mobility. Intergenerational mobility happens when the social position changes from one generation to another. The change can be upward or downward. And the last type is intragenerational mobility. The intragenerational change in societal position occurs during the lifespan of a single generation.
Next, social stratification. What is social stratification? Okay, social stratification refers to a system by which a society ranks categories of people in a hierarchy. There are 4 types of social stratification. The first one is social, and then the second one is class, followed by gender, and then the last one is ethnicity. The relationship between social stratification and social mobility, it refers to the movement within the social structure from one social position to another, or called as change in social status. all societies provide some opportunity for social mobility, but the societies differ from each other to extent in which individual can move from one class or status level to another. And it is said that the greater the amount of social mobility, the more open the class structure.
Factors that affect health inequality among social classes. There are four factors which are diet, housing, working condition, and level of income. First factor is diet. People in lower social class usually come from poor family, so many of them did not have money to buy nutritious food, and this will lead to unhealthy diet. Second factor is housing. High social class normally live in healthy environment where the environment is not polluted, so the risk of getting disease is very low. And the third is working condition. Occupation can affect mental health of someone. This is because of the different working environment between the social classes. And the last is level of income. Total income is different according to the job grade. Low income is normally for low grade, and this will lead to the insufficient money for emergency need like medical fees.
Research studies on social mobility and health. First, health gaps continue between rich and poor. PSE team found two main reasons. First, poverty causes ill health. Second, poor receive less quality of health services. Government figures show that the more deprived an area, the fewer number of GPs. It's the reason why the poorest groups in society are less likely to seek health services. Thus, PSE team suggests the GPs to work in deprived area to improve health services for poor income groups. Second, early disadvantage linked to smoking. Study found that parental social act as strongest predictor among children aged 10. ALSPAC said especially those who's from higher income households. Such factors to children are low IQ, being a bully, being depressed. Hence, researchers' strategy is reduce childhood social disadvantage. Third, breastfeeding could reduce inequalities. ISER said breastfeeding leads children to have better infant health, such as lower respiratory tract infection, diarrhea, and being overweight, as well as better academic outcomes and less socio-emotional problems. Thereby, UNICEF said mothers benefits from breastfeeding support in hospital.
The fourth research study is longer parental leave benefit baby. Children's development is affected by parental education and social economy. Researchers has focused on postnatal behavior on child outcome and parental behavior, which are maternal smoking, alcohol consumption, and eternal care. The result of the study is mother who stopped working earlier on the 3 months of pregnancy improved the birth outcome, and maternal smoking during pregnancy reduced birth weight and foetal growth area through. Next is parental health linked to child health and development outcome. A range of development factors and parental influence early child health. Research on parental health such as smoking, alcohol consumption, and body mass index. The result of the study is poor child health was more likely in family with semi-routine than the provincial family. Children with poor health likely to have high behavior difficulty. They also increase in child obesity and low score in cognitive tests. The early predictor of inequality is needed as it acts as a predictor in the health problem and inequalities. Researchers highlight on link between weight at birth and long-term health outcomes. The result is male cognitive development at age 3, female cognitive and behavior development at age 3, and also parental shock, which are further epidemics. Thank you.
So next, the implications toward health. The advantages of social mobility that are mostly for the upper socio-economic status people are high effectivity for fresh produce and also comfortable life with less chronic diseases. For mostly upper socio-economic status people, they can produce more fresh and healthy generations as they can gain enough and better high-class treatment at the healthcare center. The disadvantages of social mobility towards health are mostly for the lower socio-economic status people. It is because they tend to get unequal treatment and services, which lead to the increase in chronic disease, as they do not have enough money to buy good healthy foods and also have lower immune system. They also get uneven distributions of environmental hazards, such as exercise facilities and also health programs. All of this would lead to the increase in mortality rate and also increase in mental health problems, especially for the young adults. The young adults might suffer from mental health problems like depression, anxiety, and also stress.
Moving on to the implication of social mobility towards nursing. One of the positive effects is national unity is increased as all races are recruited to reflect the multiracial composition of the nation. Next, there will be projection in different ideas. People with different status and cultural backgrounds will have different ways to express themselves, to convey ideas and perspectives for facing challenges and obstacles. It will stimulate nursing students creatively. On the other hand, there are also negative effects. The first one is ethic and cultural problems among nursing students, care and service. Different attitude, values, behavior, punctuality, confrontation and ethic will be a problem soon. For example, a Japanese colleague may feel inappropriate to leave their workstation before their manager. Next, financial problems are bane of people in social mobility. It is also a substantial burden on the lifelong economic condition. Low-income students have a little support beyond their resources to pay off their tuition debt, but more privileged ones would pay their tuition easily as they have parents' financial support. Lastly, unemployment factor as a nurse. This is due to risks of not graduating as they did not complete the degree due to debt. In fact, the rate of graduation depends on the economic and social condition of the student, not the nursing institution itself. Higher rate of graduation occur at elite college, but less elite institution will have lower rate of graduation.
Based on the Quranic ayah of Surah Al-Baqarah ayah 177, Allah told us to spend our substance out of love for Him, for our kin, for orphans, for the needy and for those who ask. We have to be steadfast in prayer and practice regular charity, instead of need to be firm and patient in pain, suffering, adversity, and throughout all periods of panic as Allah wants to test our faith. To maintain a just and fair socio-economic order for society, we should care about others' health by doing welfare and help the needy to get essential items like food, clothes, and many more. It is one of the ways to seek Allah's blessing so that our treasure will not be spent in vain. As we already know, the most important in the hierarchy of needs is physiological needs. So duality should be able to help them, as in Islam, we are all Allah's creatures, without focusing on certain understanding and ethnicity. Nowadays, many preachers and other organizations organize a welfare program to help give daily needs to those who are unable and poor. In short term, sharing is caring. That is how we should apply Islamic obligation to social and community.
The relationship between social mobility and health in Islam. In Islam, Allah has arranged everything, includes sustenance, equity. There are the hikmah or reasons why Allah makes some of us poor and some of us rich. It is because the poor people will always depending and put their faith in Allah, and the rich communities will be grateful to Allah for blessing them with their wealth. For instance, we can see during the pandemic COVID-19, many wealthy people come to help the poor people by donating money, masks, food, and even PPE to our frontliners. But in the other hand, the people in need and have iman in their heart will be patient with all the tests from Allah.
In conclusion, a person's health care depends on demographic factors, which is determined by their social class, gender, ethnicity, education, and occupation. People who get poor health care usually from lower social class, which family with lower income. Same goes to women, black people, and people who have poor education exposure and low occupational status. However, people who have better healthcare commonly from higher social class, which family with high income. Same goes to men, white people, and people who have better education or well educated and high occupational status.
Last but not least, Helena Digel once had said that the difference between rich and poor is becoming more extreme, and as income inequality widens, the wealth gap in imaginations, education, health, and social mobility are all threatened. Hence, we can conclude that most of worldwide societies have made great strides toward more equality between the haves and the have-nots in terms of the standard living and life chances. Besides, poverty is not an accident like slavery and appetite. It is a man-made and can only be removed by the actions of human beings, as health-related mobility may both widen and reduce social class health differentials.